Dear friends, wherever you are, good morning, good afternoon, and good evening. As most of you know, October is the Down Syndrome Awareness Month, and we are at the end of October. But we don't stop here. We cannot stop the awareness in any month. Even though I personally believe every day is a great day for parents like myself to help others learn about what Down syndrome is and what are some of the unique challenges of raising a child with Down syndrome, as well as how much the children with Down syndrome have in common with the typical children. So we don't stop really in October because October is called as a Down syndrome awareness month. We will continue that in November, December, and throughout the year we have to educate them. But I still think having an entire month specifically dedicated to raising awareness about Down syndrome is a fantastic jumpstart to help us all. Remember that every day is a great day to raise awareness. So we don't stop in 1 month. So we have to continue giving awareness to others and educate them what exactly Down syndrome is. Because the most of the problems Down syndrome parents facing today within the society are lack of awareness, and not many people know what exactly Down syndrome. We still hear a lot of questions like how the treatment goes, is he or she is okay, is it completely cured, why don't you try such and such doctor, that kid got improved, and things like that. So answering those type of questions in one word, it's not the correct way. If we do that, they will come back with the same question maybe in few weeks. So we have to educate them first. Educating is the overall goal. So let them understand, let them know what exactly Down syndrome is. Let's first understand in simple term. I'm not a medical doctor, but I'm a father with a Down syndrome boy and a victim of most of the questions I mentioned before, and also facing a lot of challenges. Down syndrome is one of the most common genetic birth defects. Down syndrome was first described as a syndrome in 1850 by Dr. Down. He noted that number of children that were delayed in development had similar physical features with each other. This is one of the first best described symptoms. Usually, children born with the conditions have some degree of mental retardation, as well as the characteristic and physical features. Many of these children also have other health problems. Normally in each cell in human body contains the 23 pairs of the chromosomes. You can see here the pairs 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, and 23. So this is the typical human body contains the 23 pairs of chromosomes, which contains the genetic material that determines all our inherited characteristics. So we receive half of each chromosome pair from our mother and other half from our father. Individuals with the most common form of Down syndrome is the trisomy 21 have an extra 21st chromosome. If you can see here in this picture, this is the 21st pair, 3 instead of 2. So this is the reason it's called a trisomy 21. The individuals with this condition have 3 copies of 21st chromosome instead of 2. So no one knows exactly why this chromosomal errors occurs, but it does appear there is a little bit connection with the age of the mother. But we know from our case and other known cases, it is not true. But according to the study and statistics, women at age 25 and above, risk of having Down syndrome child is very likely than early age. The risk increases to 1 in 952 at age 30 to 1 in 378 at age 35 to 1 in 6 at age 40 and 1 in 35 at age 45. However, 80% of the children born with Down syndrome are born to mothers under the age 35. This is because most of the babies in general are born to younger women. Each year in the US, approximately 1 in every 800 to 1000 newborns has Down syndrome. This results in approximately 5,000 children born with Down syndrome each year. In the US, Down syndrome affects approximately 350,000 people. As many as 80% of the adults with this condition reach age 55 and many, live longer. Down syndrome is not a disease. This is one of the important part of my speech, that to tell people, let everyone know that Down syndrome is not a disease. There is nothing can be done to prevent this genetic disorder either before or during the pregnancy, and it is not because of someone's fault. It is not something we can fix through surgery or medications, and it is a lifelong genetic conditions. It is a lifelong genetic conditions. The moment when doctors say, I'm sorry to have to tell you this, but your baby has Down syndrome, the words will change forever the lives of the parents. That's a very terrific word for the parents when they hear first time from the hospital. There are many challenges a child with the Down syndrome and the family raising the child faces. They have varying degrees of learning and language disability, as well as impaired motor skills ranging from mild to severe. And they also mature at a slower pace emotionally, socially, and intellectually. Families face a lot of challenges from the society. The children with cognitive problems are subject to 10 times more abuse than typical children. The incidence of abuse in families with a disabled child is twice that of typical families. Siblings of a child with a disability are 4 times more likely to be maladjusted than their peers who have typical siblings. Families requires much time, effort, and dedication, as well as patience and realistic, expectations. There are many tasks involved in caring a child with the Down syndrome, moving from frustrations and challenges to accomplishments and achievements, adjusting with the society in one side and raising the child on another side. The only medicine or medication works for a Down syndrome child is love, sacrifice, dedication, and tireless try and encouragement. Everything else is just a disappointment. And I urge you, I request every one of you to spend some time, go to the nearest library or browse through books or magazines and read all about Down syndrome. Help the families with the Down syndrome and other genetic disorder. There are many organizations working for helping children and families with the Down syndrome and other type of genetic disorder and disability. Nestcare Foundation is one of such. Please work with any of the organizations in around your area and the society, and just help them. They need your help. They need really your support and help. So do your part and educate your surroundings and learn about the Down syndrome. Help the organizations. Thank you so much for watching and listening, and please spread the word, increase the awareness about the Down syndrome to your family, children, colleagues, and neighbors and society. Thank you. Have a good day.